Hi, everyone. Welcome to our Facebook Live. I'll do a quick introduction. We have with us today Mayor Robinson and representatives from Spencer Hospital. We hope to provide you with some additional information on the COVID-19 situation and answer any questions that you might have. So if you have questions, please submit them through the comment section on the live feed, and we will do those at the end. And now I will turn it over to Mayor Robinson.
Hello, everyone. Thank you, Amanda. Thank you for everyone who's tuning in. We said at the onset of this 3 weeks ago that we were going to try to do some things to keep in contact with everybody and keep people informed, and so this is a continuation of that. We have some people here, as Amanda said, from the Spencer Hospital, and wanted to just bring them in, give you guys a little update, and move forward with some information. So on the city side of things, what I'd like to go over, we're going to talk about some things that are open, we're going to talk about some things that are closed, and we're going to talk about some ongoing discussions that are currently happening. So things that are open. The grass and tree dump is currently open. Normal seasonality there. A reminder, when you use the grass and tree dump, don't take anything other than that out there. So we've found furniture, we have found dressers, we have found, just random crazy things. Please do not abuse that. The normal rules apply. Grass and trees and clippings and yard waste only. The golf course is open. We fielded a lot of questions about why the golf course is open. The golf course is open for a couple reasons. Number one, it's an outdoor activity that allows for social distancing, so there are new rules in place. Please consult the golf course for those rules. They deal with social distancing and usage of the outdoor facility. So we consider, golfing activity in the same realm as biking, jogging. Our trails are still open. It's a big open area. Please go out and utilize that if you want to keep healthy on the mental side of things, as well as your activity level to keep that up. Parks are open, although playgrounds are closed. Why are the playgrounds closed? They're closed by order of the governor. She has closed all playgrounds, so we would ask people to respect that. Parks are open, playgrounds are closed. And, the touching of the equipment and the potential spread and things of that nature is the main reason why the governor closed the playgrounds. We do have signage up now on the playgrounds, so just a reminder, they are closed. The campground is closed. We do not want any camping there until we're past the COVID-19 situation. Air service, if you were following in the press, we've been having discussions, and this was the time of the year that we were going to talk about potentially a 6-month test and allocating some funds towards that. We've decided to move that discussion backwards, forwards, I guess you could say, down the road to talk about that later. So that is a project that is on hold right now. The park master plan, we are still on track for all of those dates that have been published as far as collecting the data right now. Jared and his staff are busy with that, and then we'll get back to you as far as what the next steps on the publication and the potential projects in the park master plan are. I want to talk to you very briefly about isolate versus mitigate. The strategies that we're trying to put in place are not from a standpoint of trying to isolate things. We're trying to mitigate things, which means slow the curve, flatten the curve, and that is why we're doing the things that we're doing. We've also had quite a few questions about shelter in place and what the authority of the local government is. I wanted to let you know that the governor has asked the Iowa Attorney General to interpret where the authority lies in a shelter in place type situation, and the mayors of cities as well as the county board of supervisors do not have authority by the state of Iowa to issue any shelter in place order. So that can only come from the governor. So the governor, if you follow her press conferences, has not given any indication that she's moving towards that, but there are metrics that they're watching, and they have published those metrics, I believe. I think you can go to Representative Jones' Facebook page, and she has published some things on there. Also wanted to talk about primary residence. I would request, especially if you have friends or people from out of the area who might have recreational homes in our area, whether it's Lost Island or up at the lakes or to please consider, the governor has requested that you stay home if possible, and I would request here locally that you stay to your primary residence. If you have a secondary home, or know people that travel, a couple hundred miles to get to their vacation home, please encourage them to stay at their primary residence until we're through this COVID-19 situation. And then the last thing I would leave you with till we move on to questions after the hospital speaks is I want you to know the paradigm and the life experiences that I look through when we're making these decisions that impact our city. A lot of times I think we can get focused on just the elected official aspect of it. And I wanted to let you know, from my standpoint, when I look at this in my household, so my wife, we celebrated our anniversary last week, 18 years. She has MS, diagnosed in '94, which is an autoimmune disease. So she's at a high risk category. So what does that mean as it relates to COVID-19? So constantly the decisions we're making, I'm always asking myself, are we doing anything that would jeopardize our at-risk population? I live with and I'm married to one of those people. I have a teenage daughter, so I can sympathize with anybody who has high schoolers and what they're going through right now with the spring, being closed, and proms and sports and activities and all of these things. I completely get it. But again, we're making these decisions based on trying to mitigate the spread of COVID-19. I'm also a primary caregiver. I have one brother. Our father is 74. He's in the process of the final stages of his life. He's down to about 120 pounds. And so I'm always asking myself, as my brother and I are taking care of him, are we making the right decisions in our community? If we were to become exposed, we don't want to pass that on to him. And so those of you who are primary caregivers in your households, I completely get it and want you to understand that that's a factor as well. I'm also a business owner, so I wrestle with the daily decisions that we make related to our customers and our employees and exposure and do we need to be open, and those are all the paradigms that impact us in my decision-making process. The last thing I would leave you with is a reminder, if you are a business that has been ordered to be closed by the governor, you need to remain closed. Please stay in tune to what the orders have been. If you go against that order, there is a civil penalty. It's a simple misdemeanor, punishable by a fine. And because it is an order from the governor of the state of Iowa, we are charged locally to enforce that. And so we will be watching that. And I would just encourage you to follow the orders that the governor has put out. With that, I appreciate your time. I appreciate your patience. I know the weather's turning warm. People are a little restless. They want to get out. So please do your part to help mitigate the spread of COVID-19. And with that, I will turn it over to Dr. Amanda Young from the Spencer Hospital.
Good morning. By now, most of you or several of you are probably familiar with my face as it's been on the Spencer Hospital's website recently, talking about all of this. A lot of this will be just review, but for anybody who hasn't been on here before, this may be new. I'm sure you've heard it in other social media outlets or on the news anyways. We are in the midst of COVID-19. It is in Iowa. We've had one case so far in Spencer. Our goal right now is to flatten the curve and to try to spread this out over time. We know if we can't do that, it can have pretty drastic effects for our healthcare community. And so we would like to spread this out, and we'd like to make sure that we can do our part to not overwhelm the healthcare system. And for those that are effective, give them a good chance at having the healthcare needs that they would need and want if they are affected by this. I would like to just reiterate what the mayor had said about flattening the curve and staying home. It doesn't mean that you need to stay inside. The weather's getting really nice, so go outside, do your yard work, mow your lawn, play with your kids on your own equipment, playground equipment that you have at home, play in the yard, go for a bike ride, go for a walk. Just remember to remain at least 6 feet away from anybody that you might come in contact with while you're on that walk or while you're outside. It really becomes important for flattening that curve. But do get outside. We know that through this crisis, people having to stay at home and with layoffs and people not working like they normally would, depression and anxiety do become more prevalent during this time, and we start to see individuals that maybe haven't been diagnosed with that before start to have symptoms of that as well. So if we can keep people out in the sunshine doing things, we will help decrease that as well. A couple things I want to touch on. Number one, symptoms of coronavirus or COVID-19. Some people may be asymptomatic and not have symptoms at all. We know that children are most likely to experience that. And so that's why when we talk about this and we say that children usually have a very mild case and they may not have severe symptoms, they may not require hospitalization, the important thing to remember is that we're not just looking at protecting our children, we're also looking at protecting our elderly, those who have high-risk conditions and are immunocompromised. So because children can be vectors with very minimal symptoms, it's important to remember that and to not let them go to grandma and grandpa's house where they may unintentionally expose grandma and grandpa to this illness. So it's important that they stay home. We know symptoms may be very mild, so you may just have a cough, you may have fevers, body aches, and you may feel short of breath. A lot of individuals do become short of breath with this. 80% of individuals who get it will have mild symptoms, but 20% will have more drastic, moderate, or severe symptoms, and several may require hospitalization. There's a lot of questions surrounding testing and who can get tested. Why aren't we testing everybody that might have this? And the bottom line to that is there's just not enough tests at this point in time. Tests are becoming more available than what they were previously, so we are able to test more people than what we previously could. However, we can't test everybody who might have symptoms. If you have a mild case, we're probably going to ask you to stay home. We know that we need to protect our personal protective equipment as well for later use if we do become overwhelmed in the healthcare system. And so we don't want to utilize all of that right now on individuals who have mild symptoms as well. So we would ask that you stay home, follow the guidelines, need to stay home until you've been home for 14 days. There's other guidelines as well. They are published on the Iowa Department of Public Health's website to follow. It is important if you have a cough, if you have a fever, if you're not feeling well, that you stay home until your symptoms are resolved. Fever needs to be resolved for at least 72 hours as well before you go back to work, and since symptom onset of 7 days. That being said, if you are having more moderate to severe symptoms, if you have questions, Avera Medical Group Spencer is open. They do want to answer those questions. We have a dedicated respiratory team of nurses that are on top of all of the current guidelines, all the current recommendations, and can answer those questions and plug you in where you need to go. So if you need to be seen, we're going to get you seen. We have a dedicated respiratory clinic with Dr. Robison staffing that right now, along with some of our nurse practitioners and PAs assisting him in that. Some of those patients are able to be seen on our virtual visits or our telemedicine platform. Some we are asking to come in. Some we're just doing still curbside testing on and allowing them to go home. So we've got policies in place to determine that and determine where they can go. Also, we are still open for regular visits as needed. Right now, we are only trying to see in the clinic setting urgent and emergent visits. If you have an urgent or emergent concern, we will see you. We will try to figure out what's going on with you and provide you the appropriate care. That being said, we do not want individuals who do not have an urgent or emergent concern coming into our office if we can. This helps flatten the curve. This helps prevent exposure to other people and helps prevent exposure to our staff as well. We are, however, for some of the non-urgent and emergent concerns, seeing individuals via, again, the telehealth platform or our telemedicine virtual visits. So we can do a visit over the computer with individuals that are deemed appropriate for that type of a visit to try to help them with some of their healthcare needs during this time as well. All of our physicians have been brought up to that platform now and are doing some of those visits as we deem appropriate. There are some visits that may not be considered urgent and emergent that we still need to see in the visit in the office, and one of those or two of those are OB visits and our well child checks. So individuals or kids who need their immunizations done, we still want to see them, we still need to see them. so that then we can get their immunizations up to date. We don't want to get through this pandemic and have a bigger issue of all of our little kids not having their immunizations up to date, and then we have an outbreak of another health concern. And so those are still top priority for us. In addition, our OBs, we need to be seeing those to make sure that they're not having additional health concerns or problems with the pregnancy. And so we have processes in place to make sure that we keep those individuals safe when they do come into the clinic. We have a different process in place right now for any individuals that come in. So if you're going to be coming in, we'll go through that with you on the phone before your visit as to how you are going to present to the clinic, so that we can make sure that individuals don't come in at the same time. Other than that, social distancing is just really, really important. I don't think I can stress that enough. I've stressed that in every platform that I've been on, I think. I think I'm going to become a social distancing Nazi. My children realize that now too. That's a very common theme in our household. We talk about it all the time. So please make sure you're doing the part to flatten the curve. Other things, just really important things, if you need to go to the grocery store, Hy-Vee has curbside pickup and delivery. Fairway's still open, Walmart's still open. Please make sure though that the whole family doesn't go grocery shopping. I know it's tempting to have that be your weekend out plan, to get out and do something, but maybe go for a walk instead. Have one person go to the grocery store. If you have little kids at home that you can't leave at home, maybe there's a friend that can go grocery shopping for you, and leave them at your front door, so that then you're not taking your kids out and exposing them or exposing other people. Try to social distance while you're at the grocery store as well. Try not to be in close contact with the individual ahead of you in the checkout line or the individual behind you, and respect social distancing there as well. Need to remember those workers at the grocery stores and Walmart and Menards. They're there to help you, but we need to keep them as safe as what we can as well and not expose them. With that, I'll turn it over to Deanne Vogge from the Spencer Hospital with infection control.
Okay. Thank you, Dr. Young. I think I'll turn down just a little bit. Hi, I'm Dee Vogge. I'm the infection preventionist here at Spencer Hospital, and I'm very happy to be with you today to help answer some questions and maybe clarify a few things. First of all, I'd like to say that hospitals plan for emergencies all the time. We drill regularly, and so we have pulled out our emergency preparedness plans for this pandemic as well. So we meet daily. We have an incident command system, and I'm just so proud to say how well we have all cooperated together between the hospital and the medical community, our city and local and county governments. We have our own incident command at the hospital, but also a unified command here at the at your Spencer, here in Spencer and the county. So it's just great working together to put these plans in place. As a hospital, as I said, we are planning and preparing for COVID-19 patients that may be hospitalized. We know statistically that about 15 to 20% of the patients that develop COVID-19 will require some level of hospitalization. So we want to make sure that we're prepared and have all of our processes and supplies in place. We're also planning for a possible surge of patients. As you've seen in the news, many areas, especially in New York City and then other urban areas, are really struggling with a surge of patients that come at once. We know that that surge could happen throughout the country in the next several weeks. So we have put all of our heads together, and we are as prepared as we can be for a potential surge of patients. And so, but that depends a lot on you. The disease, COVID-19, is spread through droplet spread. So when people cough, sneeze, and or even talk to one another in a store or situation, if you're within 6 feet of that person, within 2 minutes, they think that that is considered an exposure enough to spread the COVID virus. So how do we stop the spread? Well, it's person to person. It's you and it's me. So we have the responsibility and the capability to slow down that spread and flatten the curve. Right now, there are no medications, and so there's no vaccine. So it's just behavioral. What can we do to help? And so that is our plead. Social distancing, you heard Dr. Young mention that, and even Kevin in his statements, how important that is. And I can't reemphasize that enough. And I think the most important thing I'd like to say is regarding that is it should not be seen as punitive. It really is a gift that we can give to our friends and neighbors and relatives to keep them safe and keep the most vulnerable in our population from getting severely ill. Another thing that we want to mention, again, to help protect the patients that are in the hospital and the coworkers, the staff at the hospital, Spencer Hospital has implemented a no visitor policy, as many other healthcare facilities in the area. And there are a few extenuating circumstances where we will allow visitors, but you need to talk to your provider first. And that, again, that's just a way that we can help protect our most vulnerable patients that are in the hospital as well as our staff. Let's see, anything else? I will say that, you know, if we do have a case of COVID in another case in Clay County, just to let you know that our public health department does follow up on all those investigations and does a contact investigation. So if there's anyone that is identified that could have been spread to, they are notified and encouraged to stay home and monitor their symptoms. As Dr. Young mentioned, most people will recover at home. So even if you wanted to get tested, the recommendations are to go home and stay home. So whether or not you get tested, it's the same information. Stay home and take care of yourself. So we
to Amanda.
How many tests? How many tests?
I don't know the number.
Yeah, I don't know the number off the top of my head.
All of them that are needed.
Okay. Well, thank you, everyone, for helping us out today to get the word out. We did have a couple of questions come through. The first one was how many tests have been performed in Clay County? We don't have an exact number, is what I'm hearing. They've tested a lot of people, as many as have fit the criteria. But as far as an exact number goes, we don't have that right now. It's like off the top of our heads. Okay. The second question is related to unemployment. A non-essential company was told that they have to be at work. If she chooses not to come in, will she receive unemployment? So I'm not an unemployment expert. I would recommend that you reach out to the Iowa Workforce Development for specific case questions. I'd also recommend that you take a look at the information that we have posted through our social media sites, as well as the Iowa Lakes Corridor, on the Families First Act that was passed a few weeks ago now, that extends sick leave for employees who are out because they've been infected with COVID-19, or they have reason to not be at work because of underlying health conditions. So that may be an option for you to look at. Other than that, I don't see.
You know, Amanda,
Yes.
was there a question about cloth mask? Kevin had one for us earlier that Dee can answer.
Oh, yeah, go ahead. I didn't see one pop up, but I could have missed it as well. So go ahead and talk about cloth masks.
Hi, Dee again. There's been some questions about whether cloth masks are recommended for public use when you're out and about. And historically, we have not recommended the use of cloth masks for public use. They're typically, masks are used in patients who are already sick so that we can slow the spread of an infection in the community. And so a cloth mask, if you were to use one, would be most beneficial for someone who is symptomatic, although technically you should be staying home if you're symptomatic. So will a cloth mask protect you from getting infected? And I know the World Health Organization and the CDC is exploring those things. Currently at this time, you can wear one if you'd like to wear one, but just know that it's not going to be the same level of protection as a regular mask. We want to preserve the surgical and the N95 masks for healthcare provider use, so that we can give the most protection to our healthcare providers when they're caring for patients who are ill. So in the community, if you choose to wear a cloth mask, you can. Just remember that you want to make sure and keep it clean, wash it routinely. The hospital is accepting cloth masks as well. So if there's some sewing directions that are available on the Iowa Department of Public Health website, they give you the complete directions and size of the mask and so forth. And we have gratefully accepted masks from the community already. Our purpose for using those at the hospital right now are for our staff to wear, again, to lessen the risk of getting exposed at the hospital when we're not working with an ill patient. So they're just for personal use. And so we would continue to use those if people want to wear those at work. The other way that we may potentially use a cloth mask in a healthcare setting is to help us protect our PPE. So we would actually wear it over the top of an existing surgical or respirator mask. That is as of a last resort, and I know hospitals throughout the country are exploring those, and we are eagerly waiting some recommendations from the CDC and how to proceed in those steps. So thank you very much for those who have made masks in the community, and we will do our best to use those. Like any pandemic or emergency, there's mitigation. So we do our best to reduce our risks as needed. So thank you.
All right, couple of questions that were posed that I'll try to answer to the best of my ability here. Number one, what to do about a dirty work environment. So I'm guessing that's an environment such as construction or some of the other jobs that you normally, before all of this, would wear an N95 mask or some sort of mask to protect yourself. I would recommend that should continue the same as what it was before. So if you were wearing an N95 mask because you're in a dusty environment or a dirty environment, certainly those procedures are in place by your employer for a reason and to protect you from any health consequences from that. And so I would recommend that as much as possible, you continue those practices to the best that you're capable of. If you can extend that N95 mask a little bit longer, wear an extra day, an extra 2 days, I would recommend that you do that. There was another question posed as to if you want to get tested for coronavirus, how do you do that? Where do you go? At this point in time, you do have to meet very specific criteria to be tested. We have 2 ways to test. One is through the Iowa Department of Public Health. They have the strictest criteria for testing, and so most people in Spencer right now do not meet the criteria to be tested or for the test to be sent to the Iowa Department of Public Health. The other way that we can test is through Avera McKinnon in Sioux Falls. We do send swabs up to there. They also have very specific guidelines for being tested. Their guidelines are a little bit looser than the Iowa Department of Public Health, but they're still very specific and fairly stringent on who they are going to test. So our ability to test is relatively limited at this point in time. We do have swabs available. We have tests available. However, just because of limitations in the ability to do widespread testing, we can't test everybody. So if you have symptoms and you have questions, you're not certain if you should be tested or if you fall into the category to get tested, again, please call our clinic and we would direct you to the respiratory triage nurses who can answer some of those questions. And they know all of the current guidelines and recommendations. We're following up with them every day to make sure that they're aware of any changes in the guidelines or the recommendations. So we are following best practices and can help kind of help you go through the process of whether you should be tested or not. Again, the biggest thing that I can stress is 80% of individuals will have very mild symptoms to no symptoms if they have coronavirus. We need to self-distance ourselves. We need to stay at home. And if you have mild symptoms, you may not meet testing criteria. That doesn't mean that we think that you don't have coronavirus. That just means that you don't meet the criteria at this time to be tested. You would still need to self-isolate at home for the full 14 days and follow the current guidelines and recommendations. I hope that answers the questions for everybody. There was another question of any idea when Iowa and or Clay County will peak. That's a moving target. There's a lot of different numbers being put out, a lot of different dates put out. I don't have specifics on that. While there's been dates thrown out, and I heard a potential updated date today, there were 2 dates that were thrown out. One, if we can really self-distance and socially isolate in the other if we don't, and we don't flatten the curve. Although these are incredibly loose dates, I don't want to comment on it because it's really hard to predict, and there's no science behind the prediction. So unfortunately, I don't have any general prediction for you, but potentially we'll see more cases coming in the coming weeks to month. Again, the biggest thing that we need to do is flatten the curve so we don't overwhelm the healthcare system. This is tough. This is difficult for everybody. We're 2 weeks in, and I myself am going, wow, we've done this for 2 weeks. It feels like it's been a month. But the fact that we've done it for 2 weeks and we are not overwhelmed at this point is saying that everybody's doing their part. And I really want to thank everybody for doing that, because it is very hard to stay home and not to have those social interactions.
Thank you, Dr. Young. Well, just to wrap up the Facebook Live, we appreciate everything that you all are doing on a daily basis to help flatten the curve. Number two, I told you our commitment as city government 3 weeks ago when we started this process was to pull a team together to make sure we stay on top of the resources and prepare our community in the best manner possible. We do continue to meet at 4:30 on our countywide calls. We bring in the organizations that are necessary depending on the topic or the order or the need that comes about in the previous 24 hours. We will continue to do that. We're going to get through this. In reflecting about how we truly flatten the curve, it's not going to come from top down. It's going to come laterally. And what I mean by that is it's not going to be an order from the governor or anything that your city or county government is going to tell you that's truly going to flatten the curve. It's going to be that lateral peer-to-peer influence and peer-to-peer pressure to hold your family, your neighbors, the people that you know accountable, and in a positive manner. But the solution is in our hands as individuals. The solution is not in our hands as the government to flatten the curve. And so while we're here to provide guidance, we're here to prepare when the need arises. The daily actions that are going to truly flatten the curve are in your hands. And so we would ask you to continue to do that. We're proud of the response so far that everybody has had in Clay County and in the city of Spencer. And with that, I'll turn it over to Amanda to conclude our Facebook Live. We'll do this, as we said, every week or so. We'll try to keep you updated with good information. And take care, God bless, and stay healthy.
Right. Again, thank you everyone who tuned in to listen to our conversation today, and a special thanks to the Spencer Hospital for joining us. Just a reminder that if you follow us on social media, we're trying to be as updated as possible with information, both from a personal perspective on how you as an individual can be protected and find information. But if you own a business and are impacted by COVID-19, we also are sharing very good information on how you can find support during this time. A reminder that you can always call City Hall with any questions, 580-7200, and we will do our best to get information to you. And please, as I said, follow us through our social media, and we will update as we are able. Have a great day.